we have an anterior glide and a posterior glide. And they're basically exactly the same as our anterior drawer, our posterior drawer, or our Lockmans. There is a reverse Lockmans in the literature. We just don't do it because the other ones are easier, okay? So I'm just doing a glide that is like this, all right? So here what we have is we have a concave moving on a convex, right? So we have a concave tibia moving on a convex femur, all right? So when I do a posterior to anterior glide, I'm increasing extension. And when I do an anterior to posterior or a posterior glide, I'm increasing flexion, okay? Our starting point remains 30. And then as we move into more flexion, and I do a posterior glide, I'm going to get more aggressive, right? And as we move into more extension, and I do an anterior glide, I'm going to be more aggressive, all right? You must take into account the joint line angle, okay? So basically, it's almost straight up and down here, right? As I go into full extension, my tibia and my femur are basically here. So if I do a glide, it's going to be straight up and down. And as I move it more and more into flexion, I'm going to get closer to, it's going to kind of go from there to here, okay? So as I get more into flexion, it's going to be a little bit more glide in this position, okay? And eventually I can get even where it's more parallel to the floor, okay? And in between, we can palpate the joint line and just get an idea of being in line with that angle, okay? Otherwise, it's fairly simple, all right? The only real difference here that we're gonna add is a external rotation mobilization. And it's to try to enhance or improve the end range of knee extension because of the locking home mechanism, okay? So there's an idea that if I increase, that there might be a lack of external rotation of the tibia on the femur, so then if I increase that, I will be able to improve their end range knee extension, okay? What we're gonna do, and I'm gonna do it at about 30 just because it's easy to show. So you're gonna set up exactly like you're going to do an anterior glide. But we're gonna move our hand to the medial side of the tibia, okay? So if I'm straight behind her and I pull, then her leg comes straight up, right? Well, if I move this way and I pull, her leg rotates, okay? So instead of here where I'm doing an anterior glide, I'm going to move my hand so that I'm on the medial aspect, and when I come up, I'm going to rotate the tibia. So the mechanism of what you're doing is exactly the same as if you're doing an anterior glide. It's your initial hand placement that changes, okay? And because this is something to work on extension, you can move closer to the end range of extension and do that glide. And you see I'm stabilizing the femur and I'm pulling up, okay? And then the last thing I want to show you, you have to lay your stomach here.
Oh, that's fine.
All right, I didn't warn you. All right. So you will see as an alternative that these things can be done in prone, okay? I think it tends to work pretty well. Pick up your leg here for me. I like it for the anterior glide, particularly the closer we get to extension, okay? So instead of having to pull up, I can push down, which is mechanically usually easier for us, all right? Always when we get that person in prone, who has any sort of knee pain or knee problems, I would try to support their thighs so that we're not jamming their patella into the ground, okay, and the rest of their knee, all right? So I can hold their lower leg, and I can come in here, and I can glide like this. And as I get closer to extension, I'm gonna go more straight up and down. And I can do the alternative. A lot of times you'll see people, you can rest their leg on their shoulder. I can stabilize here. I can do a posterior glide. You notice here, maybe just slightly, but her foot is not coming off of my shoulder, okay? And then I can get more here. Again, this table's not great. And I can get in here and do this. If I have to, I can stabilize here. But if I end up doing that, I'm just doing passive knee flexion, right? I'm not doing a glide, okay? So prone is an alternative position depending on how you feel that you can mechanically get up, set up. Like I said, you know, I think it definitely has a lot of advantage for this extension mobilization because I can kind of just lean into it and push in that angle as we go and try to get that extension. But it's also something that you'll see people do for flexion. As you get in here and you glide, her body weight is going to basically stabilize her femur and the rest of her body so that you can get that glide. Okay, pretty simple.